Namaskar. I am Dr. C.S. Dhar, an orthopedic surgeon practicing in Calcutta for more than 32 years. Many patients ask about the use of robot in joint replacement surgery. Now, you have to understand that it's not what exactly means that a robot is coming into the operation theater doing the operations and the surgeon is standing by. It's not like that. What actually this robotic surgery means, the surgeon puts all the data of the patient. Data means the patient's deformity of the bone, the damage of the bone, and how much angle it is deformed, and how much shortening is done, how much it is deformed. All these things we call data, and we have to put this data into the computer. This computer then, by calculation, asks us how much to cut from where of the knee joint parts. Accordingly, the surgeon cuts the joints accordingly so that the implant or the prosthesis has been put in the right mechanical axis so that it is same as it was the original knee joint. So the robot actually helps us to do the surgery, or helps the surgeon to do the surgery in more accurate way. But lot of things depends on this, like putting the data on the computer, which has to be right. If it is not properly done, then the calculation may go wrong. Same thing during the operation, how much you will cut and how much you will listen to the computer, whatever the robot is asking us to do, like that. Now, this robotic surgery may be 2 types or 3 types, you can say, where everything calculation is done. Also, the cut part is also regulated by surgeon, kintu cutting is by the robot, it's saw. So there is, if there is anything goes little bit wrong, it may be not as successful as it should be. So you have to be careful in putting the data on, using the right robot. There is another type of robot where it gives all the calculation, the surgeon himself cuts the surface of the joint where we are doing the resurfacing. So in other words, the surgeon has to be mastered in this surgery before using the robot successfully. So that is one thing. The advantage of this, if it is properly calculated and done, obviously result may be better. But on the other hand, the disadvantage is you have to be mastered in conventional surgery to use the robot in this surgery. And secondly, the cost factor. Obviously, the cost of the operation goes significantly high if you are using, or if the surgeon uses the robot. Initially, the time also requires more than the conventional surgery. So it is an advancement in this procedure, but at the same time you have to be mastered. Till date, all the data comparing the conventional surgery, that is doing the surgery without robot and the surgery doing with robot, does not have much difference in the ultimate outcome. So it's up to, I think, yet we have to wait for some time before we can say yes, robotic surgery is superior to conventional surgery.